Hi guys, welcome to this year's Restart a Heart Day 2020, hosted by Yorkshire Ambulance Service. My name's John Thorderson, the Community Resuscitation Manager. As you can see, things are a little bit different this year. Sorry we can't be there in person to teach you, but coming up we've got some videos and also an instructional video and show you how to do CPR. I hope you enjoy.
Hello, my name is Jason Carlyon and I work for Yorkshire Ambulance Service, and I would like to welcome you to this year's Restart a Heart Day. We've been running Restart a Heart Day here in Yorkshire since 2014, and since 2014 we've trained over 150,000 people just like yourselves how to perform life-saving CPR. Under normal circumstances we would be there with you on the day, and we would love to be there to teach you in person how to perform CPR and assist you with the practical elements of performing CPR on the mannequins. As it is with the coronavirus guidance as it is currently, we're not allowed to go into schools, and hence why we're doing this webinar format for you. Hopefully it works and you're able to get what you need out of it in terms of learning, and then the practical element will be down to your teaching staff in school to show you how to perform CPR on the mannequins. But before we actually start the training properly, there's a few bits of information I'd just like to share with you if I can. Currently in this country, less than 1 in 10 people actually survive from an out-of-hospital cardiac arrest. The ambulance services in this country currently work or respond rather to about 30,000 out-of-hospital cardiac arrests per year, and the importance of bystander CPR can't be understated. For every minute that goes by without somebody such as you performing bystander CPR, the chance of survival for that person drops by 10%. Getting involved as a bystander can actually double the chance of survival for a patient, and even triple it if you're able to get an automatic external defibrillator to the patient's side as well and deliver a shock. So the purpose of today is to teach you how to perform that life-saving CPR so that one day you may save a life, and you never know, it could even be the life of a loved one, family member or friend. So just to explain how this session is going to work, this is a live event and it is dependent upon a good Wi-Fi connection. If you do experience any problems at your end, submit a question and we will hopefully try and do our best that we can to advise you how to deal with that technical issue. So the format for the session is it will last about 30 minutes. Following my introduction, there will be a short video from a student who we taught on Restart a Heart Day a few years ago, who went on to save the life of somebody in the shop that she worked in. And then following that will be the actual training video itself, which is more of a tutorial. And we will then come back to the live presenter, who will summarise the key learning points, talk to you about cleaning the mannequins, and then there will be a question and answer session. So as long as you don't submit questions anonymously, we will be able to answer as many as we can on the event itself. Alternatively, if we can't answer them due to time constraints, we will email you afterwards if you haven't submitted it anonymously. And as I say, when we've finished, we will hand back to your teachers to facilitate some real life practice on the mannequins or training aids that you've got there. So sit back, watch the videos, enjoy Restart a Heart Day, albeit in a different format than normal. We do ask that you pay attention, as the skills that you're going to learn could one day save somebody's life. Enjoy the day and thank you.
Currently in the UK, less than 1 in 10 people survive a cardiac arrest.
A cardiac arrest is when a person's heart stops beating and blood can't be pumped around their body. It causes a person to fall unconscious. Without CPR, the person can die within minutes.
CPR stands for cardiopulmonary resuscitation, which involves compressions and rescue breaths.
If we achieve the same survival rate as countries like Norway,
then in the UK, every single week 100 lives would be saved. That's down to the fact that CPR is wildly taught in schools.
Yorkshire Ambulance Service is creating lifesavers by teaching CPR to secondary schools on Restart a Heart Day every year.
I'm Martha and I was a former student here at Skipton Girls High School. In 2015 I was taught the life-saving skill of CPR as part of Restart a Heart Day. Little did I know that on a break from university I would have to use this life-saving skill in order to help someone.
my partner Kathy, we decided to go to Skipton for an early coffee and a bit of shopping.
Well, it was a very early start. It was, I think, the day after Easter weekend.
Got into Skipton, I parked the car.
And then joined me at Cafe Nero's. And literally Keith had gone and got the coffee, we sat down.
And we'd been talking for 5 minutes, and literally next minute I collapsed in the chair. And that's all I remember really of that day.
My instinct initially was to think, you're just messing around, what are you doing? Nudged him. And then realised, of course, pretty quickly that he wasn't, because he didn't appear to be breathing. He seemed to be lifeless other than he was sitting. So I shouted out to the girls, please, I just need some help, please phone 999.
I was at work when a customer called me over. She was in a bit of distress because her partner had just collapsed in a chair. I went over with my colleague to go and assess what had happened, and once we arrived there, it was apparent that something was really wrong. We moved Keith onto the floor with the help of some customers till he was flat on his back, and at that point I decided that he didn't have a pulse and he was no longer breathing, so I thought it was time to use the life-saving skills that I've been taught during Restart a Heart Day and begin CPR at that point. I started giving chest compressions to Keith and continued to do so until paramedics arrived on scene about 5 minutes later.
It was just like being on a set at Holby City. That's I remember thinking to myself, this isn't real, Keith's on the floor, somebody's doing CPR on him.
Paramedics arrived on scene and they took over from me doing CPR and to shock Keith's heart 3 times. He was then taken to Airedale General Hospital to receive urgent care.
I don't remember much, well, I don't remember anything until I woke up 2 weeks after in Airedale Hospital. And Kathy told me what had happened to me and about Martha and everything that happened on that day.
I just could not believe. I just thought I'd lost Keith. I have to say, I absolutely thought I'd lost him.
It was an amazing thing that Martha had learnt this 4 or 5 years ago, and to be able then to perform it on somebody after all that time and be so good at it, it was just absolutely amazing. She was my angel in that time.
Hello, so yeah, I've come in with Yorkshire Ambulance to come and help you learn CPR today. And this skill is something that when I was learning it, I thought, oh, this won't happen to me, and it did. And well, I was just at work a few years on from having learned, and Keith had a cardiac arrest in the shop that I was working in, and I then did CPR in order to save his life, and we're really lucky today that he's with us, and he's fit and well now. When you come into these sessions, everything you learn is useful, and if you then go on to perform CPR, you've got all the tools that you need to do it. You'll have learned all the tools and all the right ways of doing things.
I can't tell you how thrilled I am that one of the students from Restart a Heart Day learnt the life-saving skill and then went on to use it to save the life of a stranger. This highlights why every year it's important for us to go into secondary schools in teaching this life-saving skill.
3, 4, 5, 6, 7, 8, 9, 10, 11.
It could be the most important thing you'll ever learn.
2 fingers underneath the chin, tilt the head back, pinch the nose close, and 2 breaths, girls.
It could be your granddad. Keith has grandchildren. My little granddaughter, she's coming up to 10. So she's not much younger now than the children that we saw today learn that technique. And if I could have half the pride that Martha's mum must have for her, and the school must have for their pupils, actually.
Restart a Heart Day is an amazing thing to learn for the children.
And I think the younger that those children are taught that technique, children are like sponges. They just absorb information.
I think teaching CPR to young people in schools is especially important, as this is something that they can then take away with them from their school careers and use in their day-to-day life with their friends, their family, or even strangers on the street who they've never met before. And they're then carrying this skill with them for the rest of their life. After learning these skills in 2015, I now know the life-saving potential that they can have, and it's something that anyone can learn given the opportunity.
So hopefully after watching that video you can see how important CPR is. There's lots of things that you learn at school, but CPR is different because although we don't want you to ever have to use it, if anyone collapses and goes into cardiac arrest, these skills that you learn today could save somebody's life. So we're going to have a look at an instructional video which is going to show you exactly how to do CPR, what a cardiac arrest is and what you need to do.
Hi guys, welcome back. Today we're going to do something a little bit different and we're going to be learning how to do CPR. CPR is something that is done when somebody is in cardiac arrest. To help me explain this more, let me introduce my friend John. So John, what is a cardiac arrest?
A cardiac arrest is a serious medical event when the heart stops pumping blood around the body. This can either be when it goes into a rhythm where it can't pump blood around the body, or it's when the heart stops.
Which is bad.
CPR is done to keep the blood flowing around the person's body. This increases their chance of survival.
Which is good.
So, what is CPR?
CPR stands for cardiopulmonary resuscitation.
This involves chest compressions, which helps the heart pump blood around the body.
During COVID, the guidelines have been modified and mouth-to-mouth is no longer recommended.
If a person goes into cardiac arrest, blood flow to the brain will stop. This means they will usually become immediately unconscious.
So to help us explain when to do CPR, let us introduce you to our other friend, Anne. As you can see, Anne doesn't talk much.
So, if you come across or see somebody become unconscious, first of all we need to check for dangers.
Examples of dangers can include cars, if the person is on a road, slippery surfaces, broken glass, on water, if the person has fallen into deep or fast flowing water.
It is important to make sure it's safe to approach the casualty. If it is not safe, do not approach the casualty. Go and get help by phoning the emergency services such as the ambulance service, police, fire or even Coast Guard.
Time for an outfit change. So, after you've decided that it's safe to approach, you first need to look for a response. Are they alert? Are their eyes open? Or are they looking around?
If they're not, check to see if they respond to your voice. You can do this by shouting, "Can you hear me?" If they don't respond to this, gently shake their shoulders.
If they don't respond to this, they are unresponsive.
Someone who is in cardiac arrest will usually stop breathing. This is your biggest clue that they're in cardiac arrest. First of all, we're going to check and open the airway. We do this by looking inside the mouth, then performing a head tilt chin lift. We do this by putting 2 fingers on the chin, 1 hand on the top of the head, and gently tilting the head back. So how can we check for breathing? During the change regulations, look for signs of breathing, but don't put your face too close to the casualty's mouth or nose. We can look for rise and fall of the chest or abdomen. If there is a risk of infection, place a towel or a cloth over the patient's mouth and nose. Check breathing for 10 seconds. This is enough time to check for normal breathing. There is something known as agonal breathing, which is present after some cardiac arrests. This involves movement of the chest and mouth, but is not normal breathing. Breathing must be in, out, in, out, in, out. If they're not breathing, this is when you need to do CPR.
But first, we need to make a call. We need to make sure that an ambulance is on its way. Call or ask somebody else to call 999 and let them know exactly where we are and that the casualty is not breathing. They will then talk you through how to do CPR.
You can also ask somebody to go and get a defibrillator if you know there is one nearby. If there is a registered community public access defibrillator, the ambulance service will tell you on the phone.
So once you're sure that help is on its way, let's start CPR.
Whilst kneeling next to the casualty, place one hand on the lower half of the sternum, then place the other hand on top, interlock your fingers, then using straight arms, push 5 to 6 centimeters at a rate of 100 to 120 beats per minute.
Is there a song that you can use to remember the rate?
Yep, traditionally it used to be Nelly the Elephant and then more recently Staying Alive.
Isn't there a more recent popular song?
I don't know, Sally, is there? Really? You need to continue chest compressions until either you become too tired, someone arrives and tells you to stop like a paramedic, or the casualty starts breathing normally. Remember, if you're using a defibrillator, it also may tell you to stop at times. Remember, rate, depth, and don't stop. So now you know how to do CPR, let's have a quick recap of what we need to do. If you find someone collapsed, the first thing you need to do is check for danger.
The next thing you need to do is check for a response. Do this by trying to get a response from your voice, if not, by gently shaking the shoulders.
Then we need to check and open the airway. We do this by doing a head tilt chin lift.
Then check for breathing for 10 seconds. If the patient isn't breathing, we then need to call for an ambulance and send somebody for a defibrillator if there is one nearby.
So then we start chest compressions, putting our hands in the centre of the chest, pushing hard at a rate of 100 to 120 beats per minute, pushing 5 to 6 centimetres each time. Keep doing chest compressions until help arrives and you are told to stop by the ambulance service, or you become too tired, but remember you can take it in turns and do 2 minutes each with somebody else, or if the patient starts breathing again. If you are using a defibrillator, this also may tell you to stop sometimes.
So now you know how to do CPR.
I hope you enjoyed the video. Before we go into some questions and answers, we're just going to have a look at the key points in that video. So first of all, if you come across someone who is in cardiac arrest, the first thing you need to do is check for danger. So Sally pointed out several dangers, things like slippery surfaces, if the casualty is in a road, or if they're in deep or fast flowing water. If it's not safe to approach the casualty, then don't approach the casualty. Call for help by calling either the ambulance service, police, fire or coast guards to make sure that it's safe to approach. The next thing we're going to try and do is get a response from the casualty. We can do this first of all by shouting and then by gently shaking the shoulders. Then we're going to open the airway by doing a head tilt chin lift. Then we're going to check for breathing. So we're not going to put our ear too close to the casualty's mouth and nose to do this. We're going to look for rise and fall of the chest. Then we're going to do CPR and we're going to do hands only CPR. So after you finish practicing with your mannequins, make sure you clean them according to the COVID guidelines, and we're going to go into some questions now. So if you have any questions, you can either submit them yourselves or ask your teachers to submit them. We're going to go to a question from Nadia. Nadia has asked, can you do harm to somebody when you're doing chest compressions? So if somebody's in cardiac arrest and they're not breathing and their heart's not pumping blood around their body, if you don't do anything, then that person's going to die. So any injuries that you do cause is always going to be less than that person dying. So don't be afraid to cause any injuries when you're doing CPR. Another question from Gus. So how many sudden cardiac arrests happen each year outside of hospital across the UK? So in the UK, we have about 60,000 cardiac arrests and 30,000 of those, so half of those are attended to by the ambulance service and resuscitation attempts are made. However, we've got a very low survival rate of less than 10%. Compared to other countries like Norway, which see survival rates of about 25%. So there's definitely some room for improvement. And the biggest room for improvement is things that happen before the ambulance get there. So people like yourselves doing CPR. So the next question is from Jerry, and it says, has the number of sudden cardiac arrests increased during the pandemic? So every year there are results and data collected. The data hasn't come in yet, but anecdotally it seems that there has been a slight increase in the number of cardiac arrests. And as most cardiac arrests happen at home, and during the COVID we've been spending a lot of time at home, and there's no doubt been an increase of cardiac arrests in the home. So we've got another question. Isn't it different on a dummy than an actual person? So there's things like the resuscitation, which you saw in the video. It is slightly different doing CPR on a dummy compared to an actual person, because when you're doing CPR on an actual person, there are obviously different shapes and sizes, and a human doesn't click when you do CPR unless you're breaking some ribs. So it is slightly different, but it's the only way we can practice it. So we've got a question from Harry. Is there a risk that someone may try to revive someone who doesn't want to be resuscitated? So there is something called a DNA CPR, or do not attempt cardiopulmonary resuscitation, which is some decision that's been made either by the casualty or the patient themselves or family members, where that person has stated they don't want to be resuscitated. If this person collapses in a public place, then it might not be known that this person has a DNA CPR in place. But if there is one in place, make sure you mention this to the call taker when you call 999, and they will give you advice on what to do. So we've got a question from Bethany. If you are telling people to do hands-only CPR, did we ever need to do mouth-to-mouth? That's a very good question. So when someone goes into cardiac arrest, their heart stops beating and they're not breathing. So because we need oxygen to survive, when we exhale, we're able to exhale some oxygen and give that person some oxygen and then circulate it by doing CPR. When you do chest compressions, as you push down and let go, some air is drawn in from the atmosphere, so the casualty does receive some oxygen. So we can do hands-only CPR, but it is better to do mouth-to-mouth as well, if possible. We've got another question from Jemima. What other songs can we practice CPR to? So the ones that were mentioned in the video were obviously Baby Shark, where I dressed in a shark costume. There's also Nelly the Elephant, which some of you children might not know what that song is, but I'm sure your teacher remembers. We've also got Staying Alive, but the rate for songs, the tempo for the song that you need to be looking for is 100 to 120 beats a minute. So 120 is 2 per second. So if you wanted to have a look for other songs that there are, the correct rate, if you look for songs that are between 100 to 120 a minute. So I think this is one of the teachers. We've got Mr. Gaffney. Won't there be a danger that someone carrying out CPR will get COVID-19? Shouldn't they wait for a healthcare professional to arrive? So it's impossible to completely remove the risk of catching COVID. That's why the new measures have been put in place during COVID. So by doing hands-only CPR, we're not doing mouth to mouth, so that reduces the risk being transmitted from the mouth to the other person's mouth. And also, if possible, if there's a risk of infection, placing a cloth or a mask or a towel over the casualty's mouth and nose, that will reduce any droplets from leaving the casualty's mouth during CPR. So although these measures won't remove it completely, they do reduce the risk. So we've got another question from Sarah. Do you need to be trained to use a defibrillator? So a defibrillator, it was mentioned in the video, and there's one shown. A defibrillator is a box that gives the person an electrical shock. So you may have seen them in supermarkets, sports centres, or train stations, things like that. They're public access defibrillators, so they can be used by members of the public, even if you haven't had any training. They're designed to be very, very easy to use. You can open them up, stick the pads on the casualty's chest, and they will talk to you and tell you how to use them. So you don't need to be trained how to use them. You can do training courses in them, but you don't have to in order to use one. So I think we've come to the end of the questions. I can't see any more questions through. If any of your questions have been submitted and have not been answered, you can go on the website afterwards and we'll try and answer all the questions that we couldn't get to. So I hope you've enjoyed the videos. Visit the website www.restartaheart.yas.nhs.uk, which will come up on the slide after I finish talking. I'm going to hand you over to the teachers. If you've had any pictures taken during the sessions, please put them on social media and use the hashtag #RestartAHeart on Twitter and Instagram. Thank you very much.